Cardiovascular drugs. Before we talking about cardiovascular drugs, we need to know how blood circulation first. The blood circulatory system, cardiovascular system, delivers nutrients and oxygen to all cells in the body. It consists of the heart and the blood vessels running through the entire body. The arteries carry blood away from the heart, the veins carry it back to the heart. The system of blood vessels resembles a tree. The trunk, the main artery, aorta, branches into large arteries, which lead to smaller and smaller vessels. The smallest arteries end in a network of tiny vessels known as the capillary network. There isn't only one blood circulatory system in the human body, but two, which are connected. The systemic circulation provides organs, tissues and cells with blood so that they get oxygen and other vital substances. The pulmonary circulation is where the fresh oxygen we breathe in enters the blood. At the same time, carbon dioxide is released from the blood. Blood circulation starts when the heart relaxes between two heartbeats. The blood flows from both atria, the upper two chambers of the heart, into the ventricles, the lower two chambers, which then expand. The following phase is called the ejection period, which is when both ventricles pump the blood into the large arteries. In the systemic circulation, the left ventricle pumps oxygen-rich blood into the main artery, aorta. The blood travels from the main artery to larger and smaller arteries and into the capillary network. There the blood drops off oxygen, nutrients and other important substances and picks up carbon dioxide and waste products. The blood, which is now low in oxygen, is collected in veins and travels to the right atrium and into the right ventricle. In pulmonary circulation, the right ventricle pumps low oxygen blood into the pulmonary artery, which branches off into smaller and smaller arteries and capillaries. The capillaries form a fine network around the pulmonary vesicles, grape-like air sacs at the end of the airways. This is where carbon dioxide is released from the blood into the air inside the pulmonary vesicles, and fresh oxygen enters the bloodstream. When we breathe out, carbon dioxide leaves our body. Oxygen-rich blood travels through the pulmonary veins and the left atrium into the left ventricle. The next heartbeat starts a new cycle of systemic circulation. Keep blood normal circulation, also depending blood pressure. What is blood pressure? Blood pressure is a measure of the force that heart uses to pump blood around your body, and also the force of blood against the walls of the blood vessels, known as arteries. Blood pressure reading is based on two measures called systolic and diastolic. The systolic, top, number is the measure of the pressure force when the heart contracts and pushes out the blood. The diastolic, bottom, number is the measure of when the heart relaxes between beats. Mainly influence factors of blood pressure including cardiac output, peripheral vascular resistance, volume of circulating blood, viscosity of blood, and elasticity of vessels walls. Antihypertensive drugs mainly work by these five aspects, such as decreasing either cardiac output or total peripheral vascular resistance or both, and also diuretics, which lower blood pressure by depleting the body sodium and reducing blood volume. Some antihypertensive drug direct dilators blood vessels. Congestive heart failure occurs when the heart muscle doesn't pump blood as well as it should. Certain conditions, such as narrowed arteries in the heart, coronary artery disease, or high blood pressure, gradually leave the heart too weak or stiff to fill and pump efficiently. Not all conditions that lead to heart failure can be reversed, but treatments can improve the signs and symptoms of heart failure and help patient live longer. Drugs used to treat heart failure can be broadly divided into two categories. Drugs with positive inotropic effect and drugs without positive inotropic effect. Drugs with positive inotropic effect increase the force of contraction of the heart muscle. Drugs without positive inotropic effect will through diuretics and vasodilators reducing heart load. Angina pectoris is another common issue of heart. Angina pectoris is the medical term for chest pain or discomfort due to coronary heart disease. It occurs when the heart muscle doesn't get as much blood as it needs. This usually happens because one or more of the heart's arteries is narrowed or blocked, also called ischemia. Drugs used in angina pectoris including organic nitrates and beta-adrenergic blocking agents. The effects of nitrates are mediated through the direct relaxant action on smooth muscles of coronary arteries. It will increase in coronary blood flow and increased oxygen to the heart. Beta-adrenergic blocking agents will block the effects of sympathetic activity such as increase in heart rate, increase blood pressure, and myocardial contractility, then indirectly decrease oxygen using by heart. Normally heart rate will be regular 60 to 100 per minuses. Heart rate controls by the cardiac conduction system. The cardiac conduction system is a group of specialized cardiac muscle cells in the walls of the heart that send signals to the heart muscle causing it to contract. The main components of the cardiac conduction system are the SA node, AV node, bundle of His, bundle branches, and Purkinje fibers. The SA node, anatomical pacemaker, starts the sequence by causing the atrial muscles to contract. From there, the signal travels to the AV node, through the bundle of His, down the bundle branches, and through the Purkinje fibers, causing the ventricles to contract. This signal creates an electrical current that can be seen on a graph called an electrocardiogram, EKG, or ECG. Doctors use an EKG to monitor the cardiac conduction system's electrical activity in the heart. Drugs used in the treatment of cardiac arrhythmias are traditionally classified into two groups, some blockers and digitalis. Sodium channel blockers blocks sodium channel so that there is an increase in threshold for excitability. Beta-adrenergic blockers will block sympathetic beta receptor stimulation. They will decreases automaticity, weaken AV conduction velocity, and lower the refractory period. Potassium channel blockers depresses SA node and AV nodal function. Calcium channel blockers acts by blocking the movement of calcium ions through the channels. Digitalis causes shortening of the atrial refractory period with small doses, vagal action, and a prolongation with the larger doses, direct action. It prolongs the effective refractory period of AV node directly and through the vagus. Shock is a life-threatening condition that occurs when the body is not getting enough blood flow. Lack of blood flow means the cells and organs do not get enough oxygen and nutrients to function properly. Many organs can be damaged as a result. Shock requires immediate treatment and can get worse very rapidly. As many 1 in 5 people who suffer shock will die from it. Antihypotensive drugs are used to elevate a low blood pressure and may increase the volume of blood in active circulation. These include intravenous fluids such as whole blood, plasma, plasma components, plasma substitutes, and solution of crystalloids. Vasoconstrictor drugs will increase blood pressure. It also increases the blood flowing. Sympathomimetics used to elevate the blood pressure include adrenaline, noradrenaline, methoxamine, etc. This is about cardiovascular drugs. Thanks for watching. If you like this video, please like the video, and welcome to leave a message. You must be my biggest motivation to make the video. Please subscribe to the channel, where you'll find more and more medical videos here later. Thanks.